Enriching lives. Regulated by the Uganda Communications Commission.
Yes, and good morning. We are coming to the end of the month of February, the year of 2026. Welcome to the Coffee Break Conversation. Every Tuesday, it is Mengo Hospital that joins us to educate, sensitize, and give us the information we need to know about our health, because our life matters a lot. Find out which kind of disease, which kind of infections, what is really disturbing you, and you need to get the knowledge about it. Mengo Hospital is here to ensure that we are living a healthier life. And today, we are going to take into another deeper conversation when it comes to the imbalances when it comes to the fats imbalances in our bodies. And joining us is Dr. Komodo, yes, Ivan, the medical officer from Mengo Hospital. Yes, Doctor, good morning. Thank you for joining us. The term or the name what we're going to talk about, Doctor will have to explain it by himself. And in the layman's understanding for us to know what we are really trying to dig deeper into. But thank you for joining us. Good morning.
You're welcome. Good morning, our audience. I'm very excited to be here to share with you. Komodo Ivan. Medical officer at Mengo Hospital. Okay. I work at the emergency department and outpatient department. Yeah, so
looking at the parts of the term dyslipidemia, one of the term that maybe Ugandans need to understand. This could be a new name to the people who are listening to us. What is it all about?
Yeah, dyslipidemia, it's a medical terminology, and we're having two words combined together. Which means dysfunction or disarranged. Then lipid, it's also a medical term, which means fats.
Okay.
Yeah. So dyslipidemia, this is a medical term, which in other words, it means that we are having imbalanced fats in our blood. So that's what it's all about.
So tell us, how does this kind of, is it a disease? Is it an infection? How does it come about?
So dyslipidemia, this is a condition. It's a condition, and it's of very important public interest because it is the source of most of the non-communicable diseases we are having. For example, hypertension, we have coronary artery disease. Those are conditions which are affecting the blood vessels supplying the heart. We have stroke. That's when we are having impaired blood supply to the brain, or cut off blood to the brain. And we have peripheral artery disease. So we have quite a number of diseases which arise from dyslipidemia. So, and the most important thing about it, why we have a lot of interest with it, it's one thing, it is asymptomatic. Meaning it doesn't show any sign or symptom. You'll be there when you have your lipids, your fats are imbalanced in your body. And that's people will only get to know when they have a full-blown cardiovascular event. That is when they have now a condition which has arisen. Remember the conditions I talked about. Maybe a stroke, that's when they will check and they'll be like, oh, your fats are hypertension. Yeah, so that's why it's very important. So we know how we are standing, and we know how our fats are.
You mean this kind of disease is that much challenging and maybe serious, because now if it has no signs and symptoms, that calls for a question now. If I don't know how now if an individual has this and you got to realize that someone has a stroke at their early age, maybe when they've grown up, and it comes kind of difficult for the public or individuals to find out that this kind of the disease are having it into their bodies.
Yeah, it's not a disease, it's a condition.
A condition, okay.
Yeah, it's a state when your fats are imbalanced. And what are those fats we are talking about? There are major two types of fats. We have the triglycerides and also we have cholesterol.
Okay.
So this cholesterol is also divided into two. We have the good cholesterol and also the bad cholesterol. So when we look at the good cholesterol, that is what we call, the doctors term it as HDL. Yeah, high density lipoprotein cholesterol. And the bad cholesterol, that is LDL, low density lipoprotein. Yeah. So it is of a significant public interest because we are tending to that side of where we're having more of non-communicable diseases than these other communicable diseases.
Okay.
So since it is asymptomatic, that's why we have come to talk about it, to sensitize people so that they can maybe get a routine checkup and they know where they are standing. The good thing, it is highly preventable.
Okay.
And it's also treatable. So that's the most important thing about it.
So looking at the part of who is most at the risk of developing this kind of condition, and what are the main causes?
So people who are most at risk, if you have a family history.
What you mean is that's how it is?
If you have a family history of anyone with maybe a stroke, someone who got a heart attack in your family, usually it's highly associated with this lipidemia. So it means you're at a risk. So that calls for maybe visiting the doctors to have a checkup,
So
to know how you are. Yeah. Then we have lifestyle. So the first risk is family history, and that is because of more of genetics. There is a part which is more of genetics. Yeah. So there are people who are genetically having what?
They just have it.
They have genes which bring about having some fats which are not what? Which are not good, the low density lipoproteins. Yeah. And the doctors usually call it familial hypercholesterolemia. So it's genetical, and we can carry it it's passed on from the parents, the offsprings.
Meaning it can be transmitted.
It's not transmitted. It can be passed on. Just in your DNA.
Okay.
Yeah, so those are people who are at risk. Then we have the lifestyle. The sedentary lifestyle, where we are more of inactive, so it's also a risk. Obesity, that's when you have your weight is more. Yeah, so obesity is also a risk factor. Then being inactive, it's a risk factor, and consuming a lot of fats, which we call unsaturated fats. Those
Like
unsaturated fats are classified into, we have the bad fats and we have also fats which are a bit good. So we have the saturated fats. Those are fats which are at room temperature. They are solid, like they are solid at room temperature. And some of like butter, ghee.
Someone needs to understand those things. That's why I'm asking you this question. And someone who's out there, maybe from a different part of the district, may not be able to understand what we're talking about. So it would be better if we break it down for them to understand in details. It would be better. It would be.
Yeah, so that's just a class of those fats. So also we have cooking oil. Most of the cooking oil we get from palm oil. Then we have fats from animal fat. All those are called saturated fats. So they are not good fats. Then we have another type of fat which we call trans fats. These trans fats, these are artificial fats. Yeah. For example, manufacturers can get normal cooking oil, vegetable oil, and in order to prolong its life, there is a chemical process they do called hydrogenation. So when they do that chemical process, those fats are literally not good. So people who consume more of that, they are also at a risk.
Now you talk about, you mentioned about these normal things, I think, which most of Ugandans use most of the times. So which cannot be dealt away. Yes, and we need them as for many other things. So, what is your thought about that? Because as public, even I think even viewers who are watching this will be asking themselves that same question. We use things every day. Cooking, or we use it for cooking food, it's other buttons, or so many other things. So as a doctor, what is that picture you can give out to them? Because if this also causes the condition we're talking about, then do we believe that this could be maybe increasing the high rate of this condition among the Ugandans, and yet they do not know?
Yes, it is increasing rate of those diseases I talked about. Diabetes. Yeah. We are having high blood pressure, hypertension. Yeah. So it's because of the lifestyle we're having. So such as talk. Yeah, because here we shall stimulate and we know which is good for us and which is bad. In case we are using this, what are we supposed to do so that we don't get into this bad stage?
Yes, I think now we should get into that point. What
it is hard. However, we have substitutes.
Okay.
Yeah, we have what we call unsaturated fats, and for example, I can give you some specific types of cooking oil. For example, you see olive oil.
Yes.
Such type of oil. Maybe we have sunseed. Yeah. So we have other alternatives. Then, in case we are eating maybe beef, it's better. It's rich in protein.
Yes.
However, it can contain the fats which have cholesterol.
Okay.
So it's better we do lean beef or lean protein. That's what the doctor called it.
Okay.
Yeah. Therefore, like it means like if I want to prepare my beef, let me first grill it.
Okay.
Let me roast it, and I lose all those bad fats. Then I can prepare it. So previously, that's why I was saying that the lifestyle changed. Previously, people those days used to prepare a specific type of sauce called kalo. Like they used to roast their meat, keep it, roast it to dryness, and keep it.
In the village.
And that would be more healthier than what. Yeah.
I thought that generation passed away.
Yeah, it passed away, but
give me a bit for some 2 to 3 days. You mean it is more healthier?
No, even
because
you
they would see our grandparents in the villages. They would roast the meat, keep it like for almost a full week. But of course, to see them cooking and eating it.
Yeah, it's better we eat lean because like you don't need to keep it over 2 days or whole week.
Okay.
You can just, when I prepare, I know I'm going to prepare my sauce, I can roast it or grill it so that when I prepare it, it doesn't need to take all the 2 days or weeks. Yeah.
Okay.
Yeah.
So this is coming now into our senses and minds, because me too, I didn't know about all that. But of course, it's the better since we are sensitizing the public on these causes. So looking at the part of, if you can give us statistics, how was it last year of 2025, or you can give us a report from the previous years when it comes to the rising of this lipidemia in a country, Uganda, and have you seen deaths also being part of it? Tell us more about this.
So globally, cardiovascular diseases are among the top leading cause of death.
Okay.
Yeah, heart attack, strokes, they're among the top leading cause of death. And this lipidemia, it's like the core, like it's the beginning of everything.
Okay.
Yeah. So when we're having these fats in our body, there is a way they try to damage the inner lining of the bloods of the blood vessel. So when they damage that inner lining of the blood vessel, of course, then there are some cells which will come and pick them up, and they will keep on accumulating. So during that accumulating process, they will narrow the lumen. Like they will narrow that the blood vessel is like a pipe, so the size will be reduced. So in case that happens to your heart, to the blood vessel supplying your heart, of course you will get angina, that's severe bad chest pain. In case it is completely occluded, there when it's partially you get angina, it's completely occluded, you will get a heart attack, because your heart now will be deprived of those nutrients, no blood supply, no oxygen, so you get issues. So it is the same thing which happens. Stroke, it means we are not having blood supply to the specific part of the brain. So yeah, in case it occludes that partially, that part, a specific part. Yeah, some people can get what we call TIA, transient ischemic attack. But in case it's a complete block of the blood supply, someone will get a stroke. And the stroke will depend according to the function of that area it does in the brain. Yeah, if in case the part which helps me to talk is done cut off, it means I'll stop talking or I'll get paralyzed. Yeah, so that's how bad it is. And cardiovascular diseases are the leading cause, one of the leading cause globally everywhere.
Mengo Hospital, how many patients do you receive when it comes to this?
We have quite a number of patients.
Can you give us the detailed report for the 2025?
2025, we have a non-communicable disease center where we are holding thousands and they are being followed up. Yeah, so we have quite a number of patients. They are being followed up and they are being managed because of that.
Now, looking at the part of treatment and being prevented, what practical steps can people take to protect their heart health? And looking at the part, can this be preventable and treated? And how get us into that?
So having this imbalance of fats in our body, it is the good news. It is treatable and it is highly preventable. So that's the most important thing. Yeah. So we have to take that initiative to go and do some routine checkup. We see how much our fats are doing, like how much do we have in our body. People who are at a very high risk those are people who I talked about, like maybe if you have a family history of someone who got a heart attack, stroke, someone who was amputated because of peripheral artery disease. So those ones should start earlier. In fact, we encourage routine checking up. So these people who are at a lower risk, for them they can do at least every 2 years. You go, they check, and checking it's a very simple process. They just get a blood sample from you and they do what we call a lipid profile. Doctor,
before you proceed, when it comes to the family history, we need to get this clear for our viewers to understand this in better concept. Family history, you mentioned about that it is genetic, right? And maybe there's some people who could be having that condition. And you mentioned that this thing has no signs and symptoms, yes? Now, how can it be preventable? Because if I wait in my family, I knew that it was someone who had this thing, and I haven't yet known that I'm also having it, because this now it has no signs, it can't even show that you're having this kind of a condition. How can you be able to help such an individual?
So, there are things we can do, and our lifestyle modification, like we modify the way we are handling our routine activities, how we are feeding, diet. So like we talked about diet, we modify our diet. We prevent, we try to avoid eating things which have those other bad fats we talked about. And we try to do more fruits, vegetables, other fibers, diet, like these other foods, than taking junk food. Is it called fast food or junk food, something like that? Than maybe taking fries, chips and chicken. We try to do the other type of thing. Then another thing, it's exercise. So it's recommended to do at least 150 minutes of aerobic exercise a week. So in a week, 3 times, each lasting 30 minutes. What are aerobic exercises? Aerobic exercises, it's a type of activity, rhythmic activity, which will increase our heart rate and also our respiratory rate. So there is an easy way of knowing that the exercise I'm doing, it's aerobic or it's not. If you are doing an exercise and you can talk normally, but you can't sing, it means it's aerobic. But if you're doing an activity where you can sing, then it's more or less an aerobic exercise.
Now, looking at the fact that this is a problem to most of the Ugandans. And why can this be predictable or detained at the early stage? Because I don't know if the adults are the major victims to this, or even the young people, or even the children.
Yeah, it is predictable because according to our risk factors we had, you can easily know. Like, for example, overweight.
Overweight, yes.
Overweight.
Okay.
If you are overweight, of course, there are high chances that your lipids will be high. Yeah. Also, comorbid patient. There are patients who have other conditions, for example, diabetes. So it is highly associated with it, with having an imbalanced fats in the blood. Yeah. So it can also occur in young children. Remember, I talked about the other genetic part. So there are specific genetic conditions where young children can have it. That's what the doctors call it familial hypercholesterolemia. So there is a specific gene in which is impairing the metabolism of those fats in our body, and our body ends up making more. So those people, you can easily know. Someone will get stroke at an early age. Yeah. Because most times, since most of us who don't have that health seeking habit, like going for a medical checkup when we are doing well, so most people are found. That's why I said usually it is asymptomatic. However, we find out when we have a full-blown event. Like most people are got when there is something which has happened. So but we can predict.
Now, the part of the treatment is it the same for the young and the adults?
Yeah, the treatment is the same. We have multiple medicines we can use to treat. We can do the lifestyle modification, we improve our diet, we do the exercises, and then there are treatments. So when the doctors assess you, there will be a specific range where they will put medications on you. Or when they assess a risk factor and they see that you're at a high risk of it, there will be a specific medication they will put on you than waiting to first get the problem. So they will always do what they call prophylaxis.
Okay.
So there are quite a number of medicines, and they can be used both in adults and young. There are those ones which can prevent absorption of the cholesterol from our digestive system. A specific class for that. Then there is a specific class in the liver which can help us, which can stop the enzymes to making that bad cholesterol. And there are quite a number of other medications. Sometimes they can even use combinations. They can add them up. It's according to how they have assessed you and how much risk you have. So it is highly preventable and it is highly treatable. Lifestyle modification alone can do a very big change
than the treatment, than the medicine.
It can do a very big change. However, some people they add the medicine because of the increased risk. There are some people who have when they are, for example, they are low density lipoprotein, that is LDL, the bad cholesterol, it is so high that lifestyle only won't put it down to the target. So where they have to combine now, you add lifestyle, then weight loss is very important if you're obese, because that would do so much difference.
Okay, otherwise get into a quick commercial break. We'll be right back in the last segment to discuss more about this kind of condition.
This is Church of Uganda Family TV. Enriching lives. Regulated by the Uganda Communications Commission. This is Church of Uganda Family TV. Enriching lives. Regulated by the Uganda Communications Commission.
And welcome back from the quick commercial break. We're still with Dr. Komodo Ivan, medical officer from Mengo Hospital, and we're looking into the condition, dyslipidemia, which is more commonly among the public, and they are not aware about this. It has come, all this is caused due to different kinds of things, the things we eat, the diet, and so many other. At times it is also genetic. So it calls for our attention as the public to know if we are having this in us and the way forward. So right about now, in just a few minutes remaining, we want to look at how does this dyslipidemia increase the risk of the heart disease and the stroke? Doctor, back to you.
Yeah, so in fact, it's the core, it's the foundation of getting stroke and heart disease. Yeah, a specific type of stroke which is called ischemic stroke. So we talked about when, just like these fats, when they are so much in our blood, they will keep on what? They will keep on adhering to the what? To the blood vessel wall. Yeah. So, and whenever they keep on adhering to the blood vessel wall, so they keep on accumulating because of specific mechanism. There is a specific medical pathophysiology. Like there is a specific way how that comes about.
Okay.
So whenever they keep on accumulating, it means they are going to reduce on the size of that blood vessel. So when they reduce the size of the blood vessel,
Okay.
then that's the area where that blood vessel was supplying, it won't get what? Blood supply. So that's where we get most of our heart diseases coming from. Coronary heart disease. Coronary, it means the blood vessels supplying the heart. Yeah. So sometimes when those fats overaccumulate, sometimes they can be unstable, and they form what we call a plaque, and it can easily rupture or break off. When that happens, remember it had adhered to the blood vessel wall, and it has ruptured, it will activate clotting.
Okay.
So that clotting itself will either occlude the whole blood vessel, and our heart won't get blood supply. Then you will get a heart attack. Yeah. Or when that clot is dislodged and starts moving in your blood vessel, it goes to your brain and lodges there, it will cut off blood supply because it will stop somewhere and blood won't go there. Then you will get a stroke. So they are the cornerstone. And there is also, in the same way, they increase the risk of getting hypertension, that is high blood pressure. Yeah, because when they adhere onto our blood vessels, yeah, they will decrease the elasticity, and they will make those blood vessels more rigid. So this will increase pressure in there, and the heart will have to work more harder to push blood through. So it is a very modifiable risk factor for heart disease and stroke. Modifiable means like something we can change, we can modify it. Okay. But if we don't change it, we can get that. We can get the stroke and the heart disease.
So how have you handled cases which are beyond your can we call it managing at Mengo Hospital, or you have been able to handle whatever emergency that you get from this kind of conditions?
Yeah, at Mengo Hospital, it's at a level of a regional referral.
Okay.
So all cases we are able to handle them there. So as I told you how we diagnose it, we just get blood. So we usually prefer fasting blood. Fasting means like someone has not had any meal for at least 8 hours.
Okay.
But sometimes we can do also random, because the other one will give us more accurate results. Here we can also do random, like I just go in, even if I had my breakfast and they take it. So they will manage me accordingly, because this imbalance of lipids, it remember we talked about the types of the lipids, the cholesterol and also the triglycerides. So it will be according, and they will give me treatment according to what I have, following the results.
Okay.
Some people have isolated LDL, that is isolated bad cholesterol only, when the rest is quite in the normal range. Yeah, some people have a mixed picture. Triglycerides are high, also the bad cholesterol is high, so they also manage me accordingly. And then there are some people who have the good cholesterol, it is so low. Remember, good cholesterol is very important.
Okay.
It has a protective effect to us. So we always make sure it is on the higher end, because it works as, let me call it as a garbage truck. Yeah, it goes and gets the bad cholesterol,
Okay.
then transports it back to the liver, where it will be metabolized, where it will be broken down. Yeah. So in case it is low, it means we are not having that protective what? Yeah. So it's very good to come and you do a routine checkup.
Okay.
As you're doing the other routine checkup of medical follow-ups, you also do a lipid profile. They check and see how much fat you have.
Okay.
Because in case they are deranged, they will manage you accordingly. And at Mengo Hospital, everything is managed
It's
well.
managed well.
Yeah.
You have mentioned about earlier on about the treatment part, and you mentioned that there's some patients who need the two, the diet part and the medication part, because of the high risk of the condition they could be having. So tell us, how has been the response of the treatment? Because now we have two categories. One may get dealt with because of the diets alone, but look at that now, leads to people, one having the two, one having the one. So how has been the response? How does this medication, or for how long does it take for someone to respond properly to this kind of terms that you give unto them?
Yeah, so they are usually followed up. So when you're diagnosed, they'll give you treatment
Okay.
for like 1 month, and you come
Consistently.
consistently for 1 month, then
Okay.
you will come and they follow you up. Yeah. However, remember what I said, lifestyle modification does a very significant role. However, sometimes they supplement you with the what? With the medications. Yeah. So when they give you medicines, it doesn't mean that you should stop the other side.
Okay.
Yeah. The exercise, the diet, we continue with both. And there are some people who have so deranged, and they put them on 2 types of medication. So it will be according to how the doctors assessed you and what you are having at hand. So in other words, patients will be managed individually. Yeah. And even everything will be tailored according to the individual patient, because you may talk about something which the patient may not be.
Yes.
May not be able to do, or yeah.
Now, looking at the part of the same line, now the patients, have you encountered a little bit of challenges because you give them description, I think that they need to follow when it comes to the treatment. Do you give them this treatment and they go with it at home, or they're supposed to come at the hospital every day?
We give you the treatment and you go with it at home.
So how they followed this treatment with good? Because now we're looking at the part of them now not taking the whole dose. They take a half of it, maybe a quarter of it, and they're going to find out because someone is feeling better, but afterwards the condition again worsens. How have you guided them?
So we have tried to do health talks with them. So in case we diagnose you with that, we try to talk to you and we tell you about the bad things which can come from the condition, and also how good things can be if you have what? If you have tried to clear the situation. So most times, most of the patients are adhere to the treatment.
Okay.
That's the good thing, because usually it's just once a day.
Once a day.
Yeah, once a day pill. You just take it once a day. Then after we do just a follow-up lipid profile and we see how we are doing. However, there are some people who are, especially people who are comorbid. Comorbid means they have another disease contributing
to this.
Yeah.
Okay.
Yeah. So those ones, we usually push them
beyond.
Yeah. Yeah.
Now, the part of now looking at the fact that this all happens, the treatment, the diet, a patient, all of you out there will be asking himself or herself a question, doctor. So now how can I tell that I'm fully okay? I'm totally very, very fine. I have no this condition. Are they supposed to come back for the checkup? What are the conditions in there?
Yeah, usually you are supposed to come back for checkup. And as we're starting, I said it's very good you try to do also routine
checkup.
Yes. And you see how you are falling, where you are falling, and how your health is. So to know how far they are, it's good they check up. And the good thing is most of the people have improved.
Okay.
Yeah, and when they improve, we put them on the lifestyle modification, diet, exercise, and they are doing quite well. And also they'll feel better and they will see a marked change.
Okay.
Yeah, in case they have started treatment, and also in case they have been persistent with the diet and exercise, because diet and exercise, it alone, it does a lot of wonder into you. Because there are even some people who are not put on any medication. Yeah, they just tell them, do this, you come back after 3 months and we see how your fats will be.
Okay. Now, okay.
Then the other groups category which are at high risk, maybe they are comorbid, having high blood pressure, having blood sugars, diabetes. Those ones are followed up more routine because they're at a risk of getting multiple complications.
Okay. Now, my concern now goes to the newborn babies. We have seen babies with this heart issue disease. I think you have witnessed that. Bring for us a picture. How would they also be attained to this condition, or is kind of different?
So babies don't usually get this. Usually babies, for them, they are new. Let me just use that in quotes because they are new. So they usually have congenital anomalies with their hearts.
What is that?
Congenital, it means they are born with, their heart might be born with specific defects.
Okay.
Yeah. So they are usually having that than having this dyslipidemia. However, remember we talked about the genetic part.
Yes, the history part. Yes.
Yeah, there is that familial thing. So those ones, by at around 9, in case you have a positive family history, around 9, at the age of 9 to 11, it's good with a lipid profile. Then repeat at around that age of maybe 17 to 20, between there. We repeat it and we see how you are doing.
How the pregnant mothers have been a victim to this also?
Yeah, pregnant mothers can be a victim to this, and usually most times it's not because of the pregnancy, but it's because they had the condition, then they got pregnant. Yeah.
Has it affected them a certain way?
Yeah, it really affects, because pregnancy itself, there is a way it changes the mother's normal function of organs. So plus this condition, it means she will have sounding impaired functions, like they will be abbreviated.
Okay.
Hope you've got me.
I'm trying to get the picture. I think also someone out there needs to understand this.
Yes. Like I'm saying, in case maybe, let me say, you feel your heart racing.
Okay, yes.
Yeah.
Okay.
So when you had that, your heart will be more racing than
Oh.
this normal one. That's what I was saying. Sound like it
Yeah,
will be more.
yes.
Yeah. Yeah. But usually it's not because of pregnancy, but it's because the condition was there before the mother got pregnant.
Okay.
However, during pregnancy, it's also it's mothers who are pregnant, they are managed by different teams. Like it needs a lot of teams to manage. The gynecologist, obstetricians will come into play, and also the physicians will come into play, because a pregnant mother is a mother.
Yes.
We are dealing with two patients.
Sure.
So.
Okay, as we're coming to an end, you have mentioned about this, so maybe we can look at the last part. What advice would you give someone who has just been diagnosed with dyslipidemia? The advice you give unto them?
So the advice is dyslipidemia. This is a condition, and it is a reversible condition and treatable condition. Yeah. So in case you have it, it doesn't mean that you are finished, you're going to get a stroke just in the coming week. But you can do what we have talked about: diet, exercises, and also we avoid this sedentary lifestyle. It can help. In case you smoke, stop smoking, because smoking increases the risk of having those bad cholesterol.
Okay.
Excessive alcohol, you stop it. Yeah.
So that's the advice you have for them?
Yeah, they stop it and then they go for treatment. They go get a medical consult and they will be helped out, and their life will be better.
Okay.
Yeah.
All right, thank you so much for being part of this conversation. Yes, it has been Dr. Komodo Ivan, medical officer for Mengo Hospital, and we have been talking about dyslipidemia and what it really means in our lives. It's genetic, yes, history, background, talk about the health, the diet that you eat, obesity, and so many other things can be able to cause this kind of condition. It is preventable, it is treatable. You are advised to go for daily check-up as Ugandans to know how your health is. My name is Rita Nandero, and allow me to wish you a blessed Tuesday. May God bless you all. Shalom.